Thank you, Councillor Williams. And just to say that we have started recording this meeting. So if we could go on to the next slide, and I will talk through the agenda for today. So I'm going to start with setting the scene, and I'll explain a bit more then about my role and the services role and others on the call as well. Then we're very grateful to have people from across the system who are going to talk about what's going on at the moment, because there is so much and it can be hard to keep up with the different, this is a very complex issue. It's a huge crisis. People come here in a state of distress, and so there's a lot happening at the same time. And so we thought it was important to hear from partners. We will have a little bit of time for questions and answers, but not a huge amount of time, because the focus today really is on how we come together as a whole community and think about how we can best support people and tap into all of the resources that are there. So that's what we wanted to do. We want to be able to break out into discussion groups for half an hour, for 25 minutes before we close. So if you have got a question, please could you add it, if possible, to the Slido that's been circulated, and we can add that to the chat as well. And we will be watching that to see what questions are coming up. Then we can respond to them outside of the meeting as well. So let's move on to the next slide, and I will to the scene setting. Well, before I go on to this, I just wanted to explain why I'm here introducing this and why my service has convened this meeting. So as a policy and strategic delivery team, we work in partnership with organisations that are both statutory sector and also voluntary community sector and volunteers, and work closely with Volunteer Centre Hackney, Hackney CVS, Interlink from the Orthodox Jewish Community, and so on. And so this is a very cross-cutting piece of work. This is something that needs a huge amount of effort. And so we're convening this event, but it's really important to highlight that there are a lot of officers from different organisations who are very, very heavily involved in this as well. And we'll be hearing from some of them. But someone just has to bring this together and make a start. And the reason that we were asked to do that was because we have been developing our approach to the pandemic response and the ways that we really do value all of the different contributions that can be made from volunteers and from voluntary and community sector, and how best we can actually find ways to resource that as well, either directly through funding or indirectly through looking at what's needed together, like logistics, storage, and so many of the practical responses that are needed are going to be similar in this case. There are lots of different aspects, and I'll talk a bit about this as I set the scene to how we need to respond. At the heart of it is a scheme that government have launched, or two schemes for people, but there will be a larger number of people who will be who won't be entitled to the support from the scheme. And then of course there are people who are already here in bridging hotels in the neighbouring boroughs around us. And we also have asylum seekers already in Old Street in the hotel. So it's actually trying to get, look at the experiences across and look at how people can best help across all of those different ways that we need to respond to people in distress. And so there are people from children's on this call. I can see that Jackie, who's the director, is on the call. Laura, who's the head of corporate parenting, who will be working with in how we actually support the households who we host. And then there are people from the health system who are already working in the bridging hotel, supporting colleagues in the city. We've got DWP. So it's, yeah, there's lots of different aspects to this and lots of different responses needed. But there's also a point that actually we're still in COVID, we're still responding to a pandemic. And so actually in some ways, when we hear from Volunteer Centre Hackney, we'll also be hearing about the wider asks. And if there's people who, or people who really want to help, it may be the best way to help right now is to actually help another part of the system so that we keep that resilience going. So Councillor Williams has already said that we have a long tradition of welcoming refugees and of seeing the way that the borough is better for people who come and settle here from different parts of the world. And in recent years, we've participated in the formal scheme, the Syrian Vulnerable Peoples Resettlement Scheme. And that was led by the council. And also we've had two fantastic schemes led by the community sponsorship scheme, as well as led by Children's, the effort that is made coordinated across the country to welcome people who are unaccompanied asylum seekers and support them. So there's experience that we've tried to draw on, and it was Benefits and Housing Needs, who I know are also on the call, who led the Syrian Vulnerable Peoples Resettlement Scheme. But then Soraya and I have also worked on the community sponsorship scheme with, so not on it, but with the groups and learned from that. So there's some learning there. If we could go on to the next slide. So where are people at the moment? This keeps coming up. So when a person's seeking, let's start with asylum seekers. So let's start with the people who have been coming here through ports of entry prior to the mass evacuation in August. So when someone's seeking asylum, the Home Office will house them in an initial accommodation centre before they're moved somewhere else. And at the moment, there is so much pressure that people have been housed in different places. Actually, Hackney hasn't had asylum seekers in recent years. But last year there was a contingency hotel, as it's called, set up in Hackney, and so there's, I know, been huge efforts from voluntary and community sector in supporting there, particularly because that it's not these aren't people who can access public support or where the council has a formal role. So if we can go on to the next slide. So at the moment, people, as I say, don't have access to public support, but also can't don't have a right to work, and actually even restricted rights to volunteer. And the support is led by the Home Office. Children can attend school, and as I say, then there is often an effort that is made, and I know that in Hackney that's been the case from community and voluntary sector. And it's only when somebody agrees that the asylum seeker meets the definition that they're a refugee, that they're given refugee status documentation, and that's usually for 5 years. So then they have to apply for further leave. So that's just to be clear about the situation around asylum seekers, actually the limitation of the public sector in working with those who are currently in the contingency hotels. So if we can move to the next slide, please. So then we have people arriving from Afghanistan, and some people will have arrived through ports as asylum seekers in recent, well, it's been going on for the last 20 years, but you know, so we have obviously people who've come here as asylum seekers, but government announced 2 formal resettlement programs. Now, they're called resettlement programs, and obviously they were envisaged to be schemes like the Syrian Vulnerable People Scheme, whereby people were identified in a refugee camp somewhere and then brought across in a scheme, or for the first scheme, which was for local employed staff, were identified and then supported to resettle. Now, obviously, that hasn't happened in the way that was envisaged because of the crisis in Afghanistan and the mass evacuation. So we're dealing with a different issue, because we're dealing with an issue where there are 2 live schemes the government have got, but there are a lot of people in bridging hotels who have come in the evacuation, and not everybody will actually qualify for one of these 2 schemes. So there is work there's a situation there where there'll be others who fall outside of these 2 schemes who need support. So the first scheme is the one that was live, has been live for a number of years, a scheme that we were looking at Hackney when government asked us to revisit the scheme in the light of the army and the American army leaving Afghanistan. So that's a scheme for locally employed military staff, and and that's the scheme that, sorry, I'll come on to the next scheme first. So then very recently, in the last couple of weeks, government has announced the wider resettlement scheme, which is for groups who are at particular risk, women and girls who may have certain careers that have put them at risk, or minoritized groups, LGBTQ groups and minoritized communities as well. And so those two schemes both have the same conditions around them, if you like, in terms of the council having a role in finding housing and in supporting people with an integration package. And in both of those schemes, there'll also be a parity around the fact that people be granted indefinite leave to remain, and that gives people rights to work and benefits, and also to apply, sorry, to work and to claim benefits and also to apply. I can see there's a question about how many people fall outside of these schemes, and I don't have the answer to that. When we hear from others who are working in the bridging hotels, we might get an idea of that, but we have to remember, you know, we have to just remind ourselves that this has been a very, you know, something that's happened at pace in terms of evacuation, and certainly that sort of data hasn't been shared with us in local government. If we can go on to the next slide. So this is what I was just alluding to, the bridging hotels, where people have been placed first in quarantine and then in bridging hotels. And this is where you'll hear in the news that because of the situation, people may be in those hotels for a long time. So the latest estimate is that there are roughly 13,000 people in hotels nationally, and in London we have 14, and in 8 London boroughs, and you can see the concentration is in central London. But that doesn't mean that people will be settled in central London. There is a process at the moment where local authorities are coming forward, and as Councillor Williams has said, we're saying 5, and I'll explain why in a moment, but all authorities are coming forward and looking at what's possible, and looking at what that means in a quantum overall as well. And then we will hear a bit more about the healthcare and the support that's on site from DWP, and the local authorities that have had bridging hotels have been heavily involved in coordinating efforts on the ground as well. So if we can go on to the next slide, please. So we have committed to accommodating and resettling 5 households in the borough across both the resettlement programmes, and it is likely to be families, but I'm saying households because we are talking about you know, if we're talking about LGBTQ or we're talking about minoritized religious groups, then we don't know yet, but it is likely, from what the Home Office is saying, most likely we're talking about families, and we're talking about people with children and with larger families. And so the reason that we've talked about 5 is because the support that's available is subject to benefit cap, the benefit support. And so we need to find housing that is affordable. And when you look at the market rate for housing in the borough, which is about £800 per week for a 4 or 5 bedroom house, then that would not give anybody, that would not give households anything to live on, and wouldn't cover that rent. So we're wanting to find a way to source housing that is affordable, and we're looking at our own housing, but housing that is not needed immediately, and doesn't take away from our long waiting list. And so that means housing that's on our regeneration sites. So that is the reason why we have got we're looking at 5, because it's based on a feasible number of houses that we can find and rent at an affordable rent. But there is a process going on in London about looking at making sure there's a fair distribution of offers, so that we can support as many people across London as possible. So that may vary. Those conversations are going on at the moment. And so I've talked about housing, but then part of the support is the resettlement package, which includes integration, education, English language, and healthcare for a period of 3 years. And so there is funding attached to that. And the intention is to commission casework. And then because we want to make this as bespoke as possible to households' needs, to spot purchase then the support. And this is where working with children's comes in, because children's have experience of working with both unaccompanied asylum seekers and also families on no recourse to public funds. So to be able to work with them so that there's a service that has good experience, that can host the family, but that across the system we can coordinate support that's needed. And the integration support we're looking at externally, you know, at an organisation that has experience of working with refugees in providing that. So if we can go on to the next slide, please. And as I said, there is funding attached to this, which covers 3 years. We want to be totally transparent about that. It's publicly available as well, that information. But I just want to caveat that once you break that down, because it's about also providing, it's about making sure that the house is equipped and furnished. So we have to take that out and then look at what is remaining, how much is needed to provide that intensive support in the first few weeks, which we know from other schemes is really important to make sure people do arrive well and understand what they need to do, and then also there's funding to support the education. I don't think English language, we don't think that's likely to be enough, but there might be, you know, this is where the bespoke aspect of the integration package comes in. Now, there's also, as I say, a scenario where people remain in bridging hotels for a lot longer. So there's also a need to make sure that wraparound support is provided while people are in bridging hotels. And overall, yeah, concerned that the funding isn't enough, although initially it was just a year, and so at least it's three years now. But still, it's not actually for intensive work and support. It's not enough. Can we go on to the next slide, please? So that's the scene setting. If you've got questions, watching the slide, I haven't had a chance to look at that myself as we've gone on, because sorry, as I've gone on, as I've talked to you, because I want to be able to bring in partners, but we'll come back after those partners have spoken, and I'll pick up on any questions before we move into the facilitated session. So I'm just checking on time. So we have so if we can bring in Rhiannon now, and we should be okay. Yeah, good to still. What about 5 minutes per person? Rhiannon, are you there?
I am. I don't know if you can see me, but
great. Over to you, Rhiannon.
Okay, great. So my name's Rhiannon. I'm GP clinical lead for the CCG, mental health, and now for homelessness. So just to set the scene about how all the health input came about, the beginning of COVID, when everybody was placing homeless in hotels, we realised we needed an outreach health response, both to people from other boroughs that were coming in the GLA hotels and into the borough commissioned hotels. So an outreach team was set up as an arm of the Greenhouse Homeless Practice. This then rapidly got extended as the refugee health, and then and we knew that we would need even more health input. I'm not sure if you can still hear me. If somebody can confirm.
We can hear you, Rihanna. We can hear you.
Great. Yeah. So the health needs. So we look at it as a sort of vulnerably housed health service, which covers homelessness, refugees, and now the Afghan refugees health needs are very different amongst the three groups, obviously, and the latest refugees will all have leave to remain. They are a much more sort of moneyed group in a way. They have access to IT, mobile phones. The refugees in the hotel in Hackney are a much poorer group, but all of them really, what our aims are is to provide acute medical care into the hotels. GP registration is absolutely crucial to get people to be able to access long-term primary, and GP obviously registration is needed because you need the NHS vaccination. There's a whole load of health input. So as I said, that's what's happening now. Our outreach team are covering many, currently have a heavy GP and nurse input because we have to get 680 people potentially registered primary care, and we're lucky that the local primary care network have agreed with patients on a route. It's enormously complex work, which I'm sure Sultan about, but we managed to get this up very quickly, and hopefully as soon as people are registered with primary care, the response to reaching can be slightly lessened. So I'm happy to take questions at the end, but I'll pass over to the team.
Thanks, Ronan. So my name is Sultan Ahmed. I am the service manager for the primary care, or ELF primary care outreach team. And essentially what we do is we go into these hotels and we try and address inequalities faced by the asylum seekers and the refugees. So that could be around digital poverty and the lack of or limited access to healthcare. So essentially what we do is we take the model in a normal GP practice, but to the hotels. We register the patients, make sure they have their initial health checks, try and gather health history. We also get a record of immunizations if we can. And essentially we try and identify if there are any need, or if there is any need for further investigations or any further input or signposting to other services. Mainly voluntary organization services that are set up to help with the refugees and asylum seekers we're looking out for. It differs what kind of problems we're coming across. Generally with asylum seeker hotels, we're coming across patients that have a lot of mental health needs or require a little bit more assistance from secondary care. There's a lot of psychological trauma. There's a lot of stress-related problems. Whereas in the bridging hotels, we're coming across patients that have a lot of physical health needs. Could be body pain. It could be arm, leg pain. It could be anything to do with their children, experiencing the colder weather, really. It differs. Really, essentially what the model we're trying to deliver in these hotels is around, how can I say this? It's around predicting the need and then trying to find referral pathways or pathways to services that make it easier for these patients to access. So that's where, that is what our goal is going into these hotels. There have been challenges, mainly because of cultural barriers, also around religious barriers. For example, the need to do cervical screening isn't easy when there are cultural barriers or religious barriers there. There's also a lot of language barriers that are prevalent, and it is difficult to try and have a consultation in a room where there is a lot of flow from other residents. We have a lot of challenges around the space provided. We have challenges around mothers or fathers trying to have a consultation while their children are around as well. So we're coming across a lot of challenges that we might not find in a GP practice, and we try and come to a solution when we can. But essentially it's around working with what we have, and which is already limited in terms of access we might have in the hotels based on the time we have with the patient. And we're dealing with a lot of turnover. It can be incredibly frustrating when we've identified a patient who needs further investigations, who need further referrals, who needs further signposting, when we find out the next day that they've been moved by the Home Office to another borough. So we're coming across problems like that, but we try and anticipate them, and we try and get things done as soon as we can, as fast as we can, and make sure the patient at least has an NHS number as well. That way there aren't any barriers down the line or in the future while while their status is being determined. So I'll pass it back to Rhiannon in case there are any questions, but if there are any questions for me as well, I'm happy to answer them. Thank you.
Thank you. Can I ask that people put questions onto Slido, and we'll make sure that they're responded to, if not today, then following the meeting. Because I'm keen that we get the other updates and we have time for discussion. So I'm just checking, because I can't see Steve Hanshaw actually on the call, although Steve, we've met with Steve in the last couple of weeks, so we've talked to DWP. Is anyone from DWP on the call?
I am indeed here, Sonia.
Are you on the phone?
Oh, Steve is on. Okay, good.
I'm just keeping my camera off because I've got a bit of tricky Wi-Fi, and I think it might affect the sound. So I'll be quite brief.
Thanks, Steve.
Good afternoon, everyone. I'm Steve Hanshaw, Senior Partnership Manager for DWP in East London, and more recently have been working with colleagues to support families that have been placed into the bridging hotels, which have been mentioned, located in the City of London. The kind of priorities that we've got, I guess, are threefold. The first is to have a physical presence of our teams located at the hotels that are in the City of London. And I think we've had roughly 4 weeks worth of time where we have a small team of 4 people engaging directly with the families at those locations. Working alongside, and this is, I guess, for us critical, and moving forwards will be the same in Hackney, alongside City of London colleagues that have also got a physical presence at those sites. And very early on, it was clear that we wanted to have our teams working together to provide as much support and advice, drawing on our experiences as we could, to the families that are located there. And it's not just City of London. We've just heard from colleagues from Elft, and we have some partner organisations that are involved in delivering that sort of front-facing service on a daily basis. At the moment, we have colleagues there for a couple of hours a day engaging directly with families. And the idea here is that we have a sort of fairly joined up message, the best we can, to families. And as and when needs are identified, we're able to, through that localized partnership, signpost people or take that piece of work on direct, should it fall within the DWP brief, to support those families that are there. The second stage, well, the second priority, I guess, in doing that is just to provide the families with some assurance and to get some local insight into the challenge that the families have. We've heard already from a health perspective, and then to think through what we might need to be doing as we move forwards. And the third part of that direct engagement is to support families that are making claims to UC to be able to make those claims to UC, either in the bridging hotel or at the job centre, which is associated with those postcodes. And then moving forward, the next bit of that journey is to ensure that as those families have made their claims, we see that process through, and critically, that once those families are engaging with job centre colleagues, that we get the right level of support, and we have the right triage and right network of support services involved in supporting that family as we move forward. And that, I guess, is really where we're anchored in this discussion, which is the critical nature of close collaboration, the best we can, across a whole range of partners represented on this call, and probably more to come along, to create as smooth and as linear a pathway as we can for the families that have been resettled in, well, it will be in Hackney, but are currently in those bridging hotels. So that's been the kind of immediate response. And the piece of work in terms of taking claims is probably reaching a conclusion in terms of the initial numbers. But we are committed to having our colleagues there at the hotel still as we continue to move forward. So that really is where we're at. And I think when we get to families arriving in Hackney, the key bit is just to have an understanding of who they are, what their needs might be, and making sure that job centres are well sited on those families, and that the network of support that is represented on the call here today is around and apparent to provide support at the point of need. So I'll leave it there, Sonia. I'll keep it quite short.
Thanks, Steve. That's great. Thank you very much. And it's great that you are in situ. I know those who have been involved in schemes before in the community sponsorship scheme, how helpful it is to just get that benefit side resolved as quickly as possible. So now going to bring in Volunteer Centre Hackney, and I know Lauren is on leave or unavailable, but Jessica Easton is here. And the reason we were really keen to get a slot for Volunteer Centre Hackney is because one of the first things that happened in the pandemic response, and has happened again, and is happening in the Slido, is people say, how can I help? And we need to make sure that we've got a way to respond to those our offers, but to keep a focus on the support that needs to be in place to make sure we keep centering the households and families, and that's why I said sometimes actually if you really want to help, it might be somewhere else that there's pressure and there's a need to help, as opposed to directly in this effort right now. But then when it comes to needing to bring in that support and that effort, is to make sure we're as coordinated and as strategic as possible, so that we're getting the best out of the offers that are there, and making the best use of people giving up their time. So that's the reason we've asked for Volunteer Centre Hackney to come on to the call and have this conversation, although you'd already approached us, so I'm not suggesting you're waiting for us to speak to you. Jessica?
Hi, thanks for that intro. My name is Jessica Easton. I'm Head of Volunteering here at Volunteer Centre Hackney. We support and promote the benefits of volunteering and community action in the borough. Thousands of people in Hackney, probably many of you here, volunteer, and we're really proud that we match people up with roles that reflect their skills, interests, flexibility, and any support needs. And hundreds of volunteers helped during the pandemic, providing essential services. What we also do is Volunteer Centre Hackney supports hundreds of not-for-profit local groups with the skills they need to manage their volunteers effectively. And we also help with them recruiting the right volunteers for their organisation too. So as you've heard so far, the specific needs of the refugees just arrived are currently being assessed, and local services are working hard to do this. If you have time available and you want to support with much needed community action in the borough, my advice to you and what we're recommending today would be to register with Volunteer Centre Hackney on our website. It's vchackney.org. There you can browse and get in touch with hundreds of organisations who need your help right across the borough. It's really easy to do so. You can search by area, whether you're interested in befriending or young people or food services. You can search by the timings you're available and many more features like that. We've got lots of roles, as was mentioned earlier, still ongoing response to the pandemic. So looking for volunteers in our vaccination centres, and befriending and supporting our neighbours getting back out into society is up there, as well as organisations that will be helping asylum seekers and refugees currently in Hackney, and hopefully those who we resettle in the future. What Volunteer Centre Hackney also does is we offer appointments, so if anyone's struggling with the website or would like to have a chat to find a volunteering role that works for you, please do get in touch and we can book you in with a member of the team. There is not a generic role up there yet for these new arrivals, as I said, their needs are still being assessed, and it's an evolving situation. But you can see exactly what is needed in Hackney, and also by registering, you'll be ready to go if and when local volunteers are needed for the new arrivals. I'd just also like to take this opportunity, because I've seen we've got various local organisations represented here, to encourage you to make sure that you also go onto Volunteer Centre Hackney's website and register there with your roles, and we can connect you with some of the thousands of residents who have got time and would like to get involved with your project, and we have lots of helpful resources there as well. I'll end just by saying a big thank you to all of you for thinking about how you can support the refugees with your time, and for everyone who's got in touch already. The specific needs in the short and long term will become clearer, but for now, if you head to Volunteer Centre Hackney's website, which is vchackney.org, and register, everything that's available is on there, and it's so easy to volunteer. And we'll then be able to let you know directly further information when we get it. That reminder of Volunteer Centre's Hackney's details will be circulated after this meeting, so you can follow those to register. That's it from me. Thank you.
Thank you very much, Jessica. And again, if you've got questions, please do put them in Slido. And if someone could put a link, again, I know it was in the information that went out, but to the Volunteer Centre brokerage page, that would be really helpful. And just to assure you that once we are clear about the needs, we will work with Volunteer Centre Hackney on what those types of roles are. And that's what we did during the pandemic. And we really, the focus was on talking to organisations about what are the types of roles that you're going to need in small numbers and in large numbers. And it did really help us, particularly in that time in August when we were preparing for wave 2 of the pandemic, to have done that work with Volunteer Centre Hackney. So we were on the front foot when numbers started to go up, meant we were able to really galvanise that huge offer of support. But we also know people are really tired coming out of the work that they have done during the pandemic for free, the support. So if there's fresh energy, we do, please do register, because I know how exhausting it can be and how hard people have worked. So we do want to refresh that pool of people as well. So if we move on now to bring in Tony and Caroline from Hackney CVS, and specifically Caroline supports Hackney Migrant and Refugee Forum.
Thanks, Sonia. So everyone, well, not welcome, but hello. So I'm Tony, I'm the Chief Exec for Hackney CVS, newly appointed, taken over from Jake Ferguson, who's been leading us thus far. So in terms of Hackney CVS's role, primarily we are a convener enabler organisation. We support the voluntary sector to do what they do best, which is serve their community. And so I guess within this space, what we see our role going forward would be to continue doing that. So, I mean, thank you for Sonia, your team, for putting this together and starting the conversation. And as others have said, this is an evolving situation. So I think as the needs become clearer, as we know what's needed, we will, we'll be on standby to help convene discussion points and create space for those new networks perhaps that need to form to mobilise the resource that's needed. Another thing that we'll do is communicate. So if there's, as I think Sonia was just saying at the beginning of the pandemic, there was a lot that needed to happen in terms of just making sure we all knew what we were each doing. So, we have our newsletter, and we would encourage you to get in contact with us if there are things that you want to communicate to each other or across the sector in terms of your offer once it's a bit more established. Then please do let us know. Our website, hackneycvs.org.uk, is the main, vehicle to kind of get in touch with us. You'll have different links there to different parts of our organisation. And then just, what we've been doing recently, which I'll hand over to Caroline to talk to in a bit more detail. But we've got, as Sonia just mentioned, the Hackney Migrant and Refugee Forum. And we've been working with them to try and understand what the issues are and preparing and building their capacity. And essentially this will be the main vehicle through which we will support this agenda item going forward. But I'll hand over to Caroline, who can give a bit more of a flavour of what the plans might be and how you will be able to get into contact with us. And Caroline's just put our various email addresses and links in the chat there if you want to make a note of those. But Caroline, do you want to come in?
Yeah, great. Hi everybody, it's good to see everybody again. Thanks for inviting us to a really important meeting. So one of the things, a couple of the things we're doing actually is that I'm coordinating all of the emails, information that come in, and as quite a few others have said, that after this meeting, we're going to look more at the needs. We'll know more needs. I'm going to coordinate and send to Volunteer Centre everybody that's offered their volunteering individual skills. I've organised a focus group on the 30th of September for organisations that want to firm up an offer they may have, or organisation support that they may have, or additional needs that they may have come across. So that's happening on the 30th of September between 1 and 3. And then from that, we are hoping to look at having a couple of open days with obviously partners, nothing set in stone yet. So that will be like an opportunity for individuals to come and access services. So we're hoping to have 2 of those sessions. And the last thing, just to say that we're also really fortunate that we've got sort of capacity building support via our organisational development team to sort of build the capacity, financial capacity largely at this point, of some of refugee and migrant organisations that are members. So anybody wants to join our focus group, I'm really happy to send the link, which I will do. And again, really want to work in collaboration with all of the partners here, and we just want to be ready and able. So when it happens, we can serve our community. So that's what I have to say. I'm happy to take any questions for this, but really looking forward to finding out the sort of like the needs and the outcomes. So thank you for having us.
Thank you very much. So that is the end of the updates that we wanted to provide from partners. And thank you again for all of the work that's going on already. So I think now that we are moving on to questions and answers. Yes, just checking. And Lisa Rain, could you just, everybody can look at the Slido, but I've just got somebody in the team who is going to just group those and put those, if you put those questions to me, Lisa Rain, and I'll bring in other people. Look, having had a quick look at them myself, I think that a lot of them will be picked up through the discussion, which I'm keen we have enough time to move into. So Lisa Rain?
Yeah, 3 themes at the moment, Sonia. Yeah. One around types of volunteering opportunity and how we can ensure well-being within volunteering. So thinking particularly about what type of roles are offered, I assume, to refugees and migrants themselves. A question about how the services available will be communicated. So will there be some communication gathering all of those services together that partners can access as well? And then also a question about how the council will commission services, if indeed they do commission any services. Those are the 3 themes.
Thanks, Lisa. And can I just check the middle question? Service, could you just had a bit of a...
Yeah, that's fine. For other voluntary organisations who want to signpost residents they're supporting, will we gather all the support available into some easily accessible communications that they can use for signposting?
Yeah, okay. So in terms of the types of volunteering, I think we've already addressed that in that we don't yet know what the full needs are, and we'll be keen to work with Volunteer Centre Hackney as we did during the pandemic on that. The types of volunteering, and so that we can think, but that really needs to come from organisations. And I think will be part of the discussion that we're going to move into is well, what is the support, and what other support needs that you're seeing already, and what the likely types of volunteering going to be. And it will be different because, as I say, we have talked about different levels of response needed. Depending on whether people are part of a scheme or are in bridging hotels and not part of a scheme and potentially there for quite a long time. In terms of the signposting and getting a really good picture of what support is available, in part of the idea of today is to start to bring together a community who can respond. And the reason that we're doing that is because we know that there's a core offer that needs to be provided for the families, let's say through casework, casework approach. We know that there'll be specialist needs as well that will need to be supported. But actually, it's that idea of it takes a village to raise a child. It takes a community to welcome people and to support people. So that's part of what we're trying to achieve today. But I think with Hackney CBS on the call, it's a part of what we'd want to talk to them after you've done your focus groups and surveys as well, is how we might be able to understand better what what support is available. Now, we've done this with the pandemic response. We've tried to bring together organisations and understand best what is going on at the moment and what's live, and I think so we can learn from that. And one of my takeaways from that is that the moment you build a directory, it's out of date. So actually it's about the relationships and the way that you systematically bring people together, often that makes it a reliable referral as well. So I think that's something to look at. But I should say that whenever we do this sort of work, what we've really got to think about is how does this put in place a more effective way of being able to work in partnership around supporting people who are refugees. So it's not just about supporting a group of households directly. It's not just about responding to the current crisis. It's actually how can we all connect better on this in the future. So that question is really relevant, because how do we know what each other's doing and make the best use is something that could come out as the legacy as well. And the question about and so I do get that point about capacity to attend meetings to promote they're still active. So I do get that, but I'm just saying it's about a balance between how much you ask people to fill in forms that keep things up to date and how much you bring people together, and it's that balance that we need to strike. And in terms of being clear about what support we're commissioning, again, the reason we want to go into the discussion is to understand what people feel is needed and get the complete picture. There will be a caseworker approach built into this, for which we will be looking for organisations with specialist expertise and experience in that area. But then there is also the wider opportunities that, as I say, need to be bespoke to the families. So that's spot purchasing. There isn't any money. We haven't been given any money to coordinate any of the response that we're doing. So all of our time and your time, is unresourced. And there isn't any money to support the wider refugee, like the wider impacts and the wider support needs of refugees as well. So I just need to be clear that beyond the families and households who we support through the formal schemes, there isn't any budget that is coming from government. So so that's that at the moment we'd be looking at the commissioning of the support for families, and that's the aspect of it where there's funding attached. Are there any other questions, Lisa Rain, that have come through? Because if not, I suggest that we move into the discussion groups.
There's a couple of questions and comments around organisations and individuals wanting to offer their services and make sure they're included in any signposting. And I've shared in the chat a link to a survey which Soraya's coordinated, where people can make those offers, and certainly then they'll all be coordinated in one central place. So do have a look in the chat for that link. And then the last question I've seen, Sonia, is around thinking about provision for social support. So how do we create opportunities for buddying and social integration beyond kind of statutory services and support, and how can we look at embedding that within the wider community of Hackney?
And I would say let's feed that in, that the next set of questions are going to be about, well, what is the support that's needed? So let's build that into the discussion that we have. And Soraya, if you could pick up the question from Julita from Care for Calais, just because I want to be able to move into the discussion. And Ben, could you put the slide back up that poses the question, which I will cover as quickly as possible. In terms of local schools, there'll be a particular ask if there's school places, and then beyond that, again, it depends on the being clear about the needs and the ask, but it's a good point about the role of schools in this, and one that we can pick up. So, so the questions now, we've got 25 minutes if we can come back here just before 6, because we're going to take notes. So I don't think we'll have time for feedback. We'll just be wrapping up at the end just before 6. The question now is to have that discussion about what good integration offer looks like for a family new to the borough, and how might support some of the needs change across time, and what might be needed short, medium and long term. And so we're thinking about people who might be supported through these schemes, but also the wider needs that are likely to come through from those who may get refugee status, but not be part of a formal scheme. And I'm really keen to tap into the expertise and experience that's there. But obviously I appreciate the point made about time. If you need to leave now and can't join that conversation, I completely understand, you know, if you just wanted to get an update, because this is really about drawing on the insight that's there, and those who have the time to provide that. I'd be very grateful for that, but appreciate those who have to go. So that's all I wanted to say on that. And actually, I haven't had a chance to introduce Soraya, who invited you to this meeting, but Soraya is supporting this conversation and works on a number of briefs, including Aging Well. Some of you may know Soraya through that, but on this has a wider policy role around migrants and refugees, and has been working with colleagues on different aspects of how we can improve support around working with migrants and refugees. And that goes back to that point about what can we put in place now that makes us better prepared and better able to support people who come here as refugees. Shall we move into the breakout rooms?
Yeah.
Can we give it the full 25 minutes, Soraya, and then we'll just do a quick close at the end, because we're going to be taking notes, aren't we? And people can also feed in through the forms.
Yeah, okay, I'll be putting you all in the rooms now, and there should be a facilitator in each of those rooms, and he'll lead the discussions.
We've only got a few minutes, but we have made some notes. Thank you to the facilitators for doing that. If Ben's on the call, could you just put the slides back up? In the meantime, I'll find it. Great, thanks, Ben. So thanks everybody again for joining us today. Soraya, is there anything before I go on to next steps and close that you needed to say? No? Okay, so we'll get everybody's ideas through from the notes. We'll use that to help us to think about both the support for the households that we're going to be directly supporting, and also the wider support. And hopefully this is helping us to start building a coalition of those who can work together, as well as with the council. There's the event which Hackney CVS has talked about, Caroline has talked about, so there's a way of working directly as a sector as well. You're welcome to fill in the survey that's been circulated, so you can register what you're able to offer. If you want to promote the volunteering opportunities, please circulate that. And indeed, if you're an organisation that needs volunteers, whether directly related to the refugee crisis or otherwise, please do look at the ways to register for support needs that volunteers today. We will be looking, as I say, at commissioning support around caseworker support, working closely with Children's to design that, who would be hosting the support to families, and the spot purchasing, and then the wider support needs which can be offered, which wouldn't be directly funded, but which we would want to offer as well. So that's the next steps. I don't think we will bring together a meeting of this scale again, but I can imagine that we would be bringing together smaller groups or working with Hackney CBS and others to do that. I appreciate how precious everybody's time is, and we'd want to get on and actually work closely together on the tasks that are needed. So I just wanted to check if Councillor Williams wanted to come back in at all before we close. I know she's still on the call, but maybe she's no. Okay. So yeah, if anybody's posted any more questions on Slido, we will answer those, and before we leave, we'll make sure that we've captured the chat that's just come in, and we've captured the chat from before. I'd like to thank Soraya and also the partners who have stepped in at very short notice to provide the updates. I'd like to thank all of you. I'd like to thank those of you who are on the ground supporting people already, and indeed those who have been working so hard during the pandemic as well. So yeah, see you in some form in the future, but lovely to see old, not old, old faces, familiar faces, I should say, and also those who have joined, who I haven't met before or have joined Hackney recently. So thank you very much. See you all soon. I'll stay on the call just in case there's any last minute questions.